Hi, everyone. Good afternoon. Pfizer received an emergency use authorization for children ages 12 to 15 last week, and Intermountain started vaccinating those in that group this past Saturday. Today, we're joined by Dr. Andrew Pavia, Chief of Pediatric Infectious Disease at the University of Utah and the Director of Epidemiology at Intermountain's Primary Children's Hospital, to address some of the most asked questions we've gotten about this topic. Dr. Pavia, thank you so much for joining us. It's nice to have you back.
Well, thanks for having me. Thanks for everyone for joining us.
Of course. So I want to start with kind of talking about the basis of this clinical trial and what's been approved now for 12 to 15-year-olds. How long has this study been going on with this specific age group? And can you explain how this study works?
Sure. So in the late fall, once it became clear that the vaccines were very effective and very safe, both Pfizer and Moderna started their trials in adolescents. And if you remember, Pfizer was already approved for children 16 to and up. So what they did was they recruited children of 12 to 15 years of age and randomized them to either get 2 doses of the vaccine, just like adults do, or to get placebo. Blood was drawn before they started the study. It was done, blood was drawn about 3 weeks after the first shot, and then another month after the second shot. And they were followed very closely for a minimum of 2 months. So that would be the last children enrolled, late in the spring were followed for 2 months. The ones who were enrolled in November were followed for about 6 months. And what they found was out of about 2,600 children, there were 16 cases of symptomatic COVID disease. And all of those cases occurred in the unvaccinated children. So that works out to an efficacy of 100%. But what's also more important in these kinds of bridging studies is they looked at the immune responses. What kind of antibodies did the kids make? How much? How well did they work? And they found that these young adolescents made antibodies at a level slightly higher than young adults, so the 16 to 29-year-old age group. Not dramatically better, but somewhat, they were even better. And they looked very carefully at the side effects, as well as look very hard for anything else that might be worrisome. And, if you know these vaccines, you know that they cause some side effects, and they found the same types of side effects at pretty much the same frequency in the adolescents that they did in young adults. And you'll remember that older adults, however you define older, but I think for the study, they defined it as 50 and up, have somewhat fewer side effects than younger adults. And adolescents fit neatly in with that young adult group in terms of side effects.
So if you're a parent who has a child within that age range that was just approved, what are some key things you'd like those parents to know when they're considering vaccinating their children?
Well, whenever you think about a vaccine, you need to think about what's the benefit? What's it doing for my child? That's sort of the first question you want to ask. And the benefits of getting vaccinated for 12 and up are really pretty clear. We often talk about how children are at lower risk of severe disease, but low doesn't mean no risk. And we've had, well over 400 children hospitalized in Utah. We think we've had 2 deaths. Nationally, more than 300 kids have died. That's more than, it's at least 50% more than in our worst flu epidemic, as long as we've been keeping records. So, there are going to be some kids who get very sick, but probably what's more important if you ask your child is what they don't want is to get long COVID. They don't want to be fatigued and failing out of their classes and unable to compete in their sports for several months. And we don't have great data on exactly how often that happens, but it's pretty common. One study, which is probably not the definitive answer, said it may be up to 50% of children have a symptom that persists for up to 2 months. I think that's an overestimate, but again, these annoying but life-changing side effects are a big deal. That's one benefit for your kids. Another huge one is that they get to return to a pretty normal life. No masks, you can go away to sleepaway camp, you can hang out with your friends. And then the last benefit, which may actually be more important to adolescents who care about saving the world than it is to jaded adults who sometimes look out for themselves more, is that by being vaccinated, they protect people around them. They help bring the pandemic to an end. They protect their circle of friends, some of whom may be at high risk of disease, their relatives, their grandparents, and their community. So that was a long way of saying what the benefits are, but I think you've got to start there. And then the second is, what are the risks? And with any vaccine, there are side effects, and we'll talk about those in a moment. So far, the severe complications, the only thing we've seen has been these rare anaphylactic reactions at about 1 in a million, and those are well handled in the setting in which we give our vaccines. Is that the only possible long-term thing that could happen? No, we don't know what else might happen at a frequency of 1 in a million, but we know that whatever could happen in terms of risks of the vaccine, the risk of getting the virus is so much higher, and the risk of having complications of the virus is much higher. And then the last thing parents need to know is this is a really effective vaccine. It is 95% effective overall in the trials, 100% effective for the small group of young adolescents, and virtually 100% effective at protecting against hospitalization and death. So, everyone has to make the decision for themselves. My kids are at an age where they made the decision for themselves and they got vaccinated as soon as they possibly could. But if they were teenagers, I'd be talking to them, involving them in the decision, but they'd have been vaccinated last Saturday.
You mentioned this briefly, and before we get to the side effects, I just have a question around mask recommendations. Do you have any recommendations for that specific age group before they receive their vaccine? And then also after, is there any waiting period of when they can take it off? I know the CDC released information this past week too, but do you have any recommendations for that age group?
Yeah, so, it's actually pretty simple. Outdoor activities are generally safe. There are a few exceptions to that, and that's probably contact sports where you're actually getting each other's saliva right in your face. So, but we haven't been masking football players. They have been getting sick, we'll point out. But outdoor activities are safe for teenagers. But indoor activities, particularly those where you're mixing vaccinated, unvaccinated people, particularly when there's poor ventilation, particularly when there's crowds, I think teenagers should still be masking until they're vaccinated. I know the governor doesn't agree with me, but that's why he's the governor and I'm not. Now, protection starts about 2 weeks after your first dose, but it's not really perfect. Really, it's bomb-proof protection about 2 weeks after your second dose. So that's really when you can do pretty much anything safely, is 2 weeks after your second dose.
So let's talk about those side effects. You mentioned that they're pretty similar to what adults are experiencing. Will you just walk us through them and what parents should specifically be looking out for if their child does receive the vaccine as well?
Sure. And I think it's really important for parents to understand that, like most vaccines, there are side effects. And if parents have been vaccinated, they probably heard this and may have experienced some of them. But virtually everyone gets some degree of a sore arm. It can be pretty sore. There can be some redness and swelling in the arm. That's about 80% will report some discomfort in the injection site. Pretty similar to some vaccines, a little bit worse than some others. The more bothersome side effects are fatigue. That's pretty common, although interesting that in this pandemic year, the people who got saline shots, also about a third of them were pretty fatigued. So it tells you something about the life we're living. But also muscle aches, joint aches, fever are sometimes side effects. Headache can occur. And these can be enough that for half a day or a day, you don't do your normal activities. How often does that happen? Well, somewhere between 20 and 30% on the second dose have symptoms that are enough to change their activity at least slightly. That might just not be going for your usual 5-mile run, or it might actually mean that you have to take some Tylenol and sit on the couch to wait for the side effects to go away. They tend to go away pretty quickly. Now, there are a couple of slightly unusual ones that people should be aware of. You can get swelling of the lymph nodes, particularly in the armpit, the axilla, or in the neck. And if that happens, it also should be something to keep an eye on. If it's very red or swollen, you should probably have a doctor take a look at it, because the swollen lymph nodes usually aren't too bothersome. And if they are, they should be checked out. There are some persistent rashes that have occurred. This is more with a Moderna vaccine that crop up a couple of days later in the arm. They seem to be pretty benign and they go away, but it's kind of surprising and disconcerting, to have your arm starts to feel better and then all of a sudden there's red blotching areas around the site of the vaccine or maybe a little bit below it. So people should know about these. It's okay to take Tylenol or ibuprofen to relieve the symptoms. That's been something that people have had some confusion about. And if there's any question about the severity of the side effects, please talk to your pediatrician, your family doctor about them. And if necessary, have them take a look. But these side effects are a sign that young adults and teenagers have a vigorous immune system that has a great response to the vaccine and generates protection. And I should add one more thing that's, I think one of the best things about the vaccines that we've learned really just in the last few weeks is that they generate pretty broad protection. What that means is that the vaccines have been now shown to provide pretty good protection against many of the variants. And that's important because natural infection with an older virus does not provide really great protection against the variants. And we're seeing more people who were previously infected, particularly those who were infected 6, 8, 9 months ago, get infected with the new variants and sometimes have pretty significant illness. That's one huge advantage of the vaccines over natural infection.
That's really interesting. I've never actually thought about what you just put into words, but that's a great reminder that if you did have COVID, you're not immune to the other variants that are out there. So that's a really great reminder. I appreciate that. I want to talk about the scheduling for vaccines. I know that with school, I know school is still going on, but school will be here for the fall before you know it, which usually requires vaccines depending on the age of the child and stuff like that. Is there a recommendation for when your child should receive the COVID vaccine? Is there any effect it might have on maybe other vaccines as well?
Well, so the really good news is that in reviewing what we know so far, the CDC has recommended we no longer have to separate vaccines. And that is a big change that just happened last Wednesday night. Now, that said, there's one group of kids that need several vaccines, and those are kids between 11 and 12 who are usually going into junior high. And there's a group of vaccines that they should get this summer, and that includes a meningococcal vaccine, a pertussis tetanus booster called Tdap, and their 2 HPV vaccines. And, we can safely give those vaccines together, but, it really is sort of a personal preference question. Do you want 2 sore arms and 2 vaccines on one day, or would you like to separate them? I think, thinking about it as a parent, it's probably easier to get everyone scheduled and get everything done together. But it, may increase the chance that for a day or two, you're going to feel kind of punky.
That's good to know about the change in vaccines. I didn't know that. So thank you. I appreciate that. Another question that we received is, with around 30% of Utah's population being children, is vaccinating them the key to achieving herd immunity in the state?
Well, I believe it's really important for us to get the pandemic under control. I think the term herd immunity has been so abused that, as an epidemiologist who learned about herd immunity and talks about it a lot, I think we need to retire it. We are probably not going to get to some magic point of herd immunity where the virus cannot spread anymore. And I just don't think that's a useful concept anymore. But the higher level of community immunity we can reach, the less spread there will be, the less restrictions we need on our activity, the less chance that we'll have new surges with the cold weather or with variants coming through. And yes, if with about 28% of Utah's population being under the age of 18, we have to get a significant proportion of children vaccinated. Now, I think the most important group are the ones that now have access to the vaccine, those 12 to 18, because they're the ones who can get sick with COVID. Most of our hospitalizations are in that age group. They're the ones who suffer the most with long COVID. And because they're social, because they have jobs, because they're out and about, they also are the ones who spread it. And we've seen that in epidemiologic data from Utah and across the world.
And looking forward too, do we expect any of the other vaccine types to become approved for 12 plus? Moderna or J&J or any of the other ones, are there any clinical trials ongoing for those specific groups?
Yeah, so Moderna is coming soon. They've completed their clinical trial. They put out a press release saying that it was 97% effective. And I don't have to give you a lecture on statistics to say there's no difference between being 100% effective and 97% effective in a moderate sized trial. And they also reported in their press release that the side effects were modest and the immune responses were great. They submitted their data in the last week or two to the FDA, so we're anticipating that in about a month. So these will be, the two different vaccines that will be available will be the 2-shot mRNA vaccines. J&J did start their trial in adolescents. They put it on hold when they were investigating the blood clot issues. I don't know for sure what their time frame is now for completing the adolescent studies. There's certainly some reason to think that 1 shot and you're done has some advantages for adolescents. But given that all the blood clots occurred in younger women, maybe the J&J is not the best choice for adolescent women when we've got another good choice that's perfectly safe. And, it's possible that J&J won't follow through with licensing for younger adolescents because of that.
That's good information to know. And in general, I'd love your opinion on how you think the pace of vaccinations in Utah is going. I think the last number I read was over 50%, if I read it correctly. But do you feel like as a state, we're doing pretty well? I think nationally, it's about 50% as well.
Yeah, we are kind of getting a gentlemanly B-. So we're doing a pretty good job. But, we shouldn't fool ourselves to think that we're among the best states out there in vaccination. I was going to pull up the exact numbers for you, but we're at about somewhere around 38% are completely vaccinated. 34.9% are fully vaccinated, and about 43.5% as of yesterday have had at least 1 dose. That's pretty good. Some states are approaching 60% with 1 dose and well over 50% for 2 doses. So, if we were the Jazz, we would say, that's not good enough. That's, not first place, and we need to do better. But I do think that the way vaccines are being rolled out in Utah is very thoughtful and very good. We had the mass vaccination campaigns where people who really wanted to navigate the system, who had the time and the energy to make their appointments, could get in and get vaccinated quickly. But now we're at the point where we have to reach out to a lot of people for whom getting vaccinated is more difficult. And that's really the phase that we've entered now. We're trying to get vaccine into as many practices and offices as we can, into pharmacies. And I think the most important thing that the Department of Health is doing right now is bringing the vaccine to places where people are, where they work, where they gather. Because, let's be honest, getting on the computer, working through a kludgy appointment system, taking an hour off from work twice to go get vaccinated, and possibly, for some people, missing a day of work or half a day of work the next day because you don't feel great is a lot. And that's, I think, stood in the way of getting our numbers much higher. Now, if we can get vaccine to people where all I have to do is, roll up their sleeve at their lunch break, I think we can make a lot more progress. We also have to do something about vaccine hesitancy. I think a lot of what we're calling hesitancy is structural barriers for people. It's inconvenience, it's cost, it's time. And then some of it is also access issues. If you don't speak good English, it's been hard to navigate our system. If you're worried about your immigration status, it's been hard to get the message that yes, you can get vaccinated with no concern about your immigration status, even though that's been true all along. If you're not insured, you and I know that the vaccine is available at no cost to everybody, but not everyone who's worried about where they're going to find the money for a doctor's appointment knows that.
You just mentioned hesitancy, and we just got another question around the age group that we're talking about, this 12 to 15. Have we heard any specific hesitancy towards this specific group from parents who maybe themselves who are fully vaccinated, but they don't want to vaccinate their children? And if you have, is there any advice you could give them?
Yeah, you hear all sorts of things. I mean, there are parents who kept calling multiple times last week to see when they could get their vaccine. And so that represents, according to some polling, maybe a third of parents that they've been waiting for this. They want to, they and their kids want to get vaccinated and get on with life. And then a number that I think's in the 15 to 20% range are really concerned and don't think they're ever going to do it. The rest of the parents are somewhere in the middle. They probably want to talk to their pediatrician or family doctor. They probably want to know how they're going to do this. They probably want to talk to their kids and make sure their kids are on board, because this is an age group where, some degree of joint decision making is totally appropriate. I have read at least one, it was an informal survey of teenagers in which they were more enthusiastic about getting the COVID vaccine than their parents were. And I wasn't surprised about that at all. I think the parents may be risk adverse. The kids fully understand that, it will let them get on with life, and it's something that they'll do for the community as well.
My last question for you is around those who are under 12. I know we've heard that there are a couple of clinical trials currently taking place, but do we have any sort of timeline for that group? And what is the youngest age right now, too, that the clinical trials are currently happening with?
So predictions are difficult, especially about the future. And that was actually Niels Bohr, who's a quantum physicist, not Yogi Berra, who said that. It's really is hard to know exactly when clinical trials are going to finish up. You can look at when they're enrolling and how quickly they've analyzed the data in the past to make a reasonable guess. And my colleagues at the NIH who have access to all the inside scoop think that September is a reasonable guess for the next age group, which will be 6 to 12. I wouldn't hold me to that. I'll give you better odds on who's going to win the NBA finals than that. But somewhere in the early fall, we should get down to 6 years of age. The studies are going down in steps, and the step after that will be 2 to 5, and then 6 months to 2 years. And really that school age group, 6 to 12, is the next most important one, because they're the ones who are in school, they're mixing a lot, and we'd like to get them back in school. If they haven't been in school, get them out of their masks, if possible, if we can get everyone vaccinated. The younger kids have actually been the group that does best so far. And I think I've said this to this group before, but we often just say kids as if COVID is the same for everyone as a 6-month-old and a 17-year-old. Well, for a 17-year-old, their risk of getting sick is much higher. The risk of getting infected is much higher. The risk of transmitting is much higher. And for 2 or 3-year-olds, it's quite a bit less. So the delay in the vaccine for that youngest age group is balancing the risk of the disease to them, which is somewhat less, and the fact that they are physiologically different, and making sure that we've got the right dose and understand the safety and the efficacy in that younger age group is going to take a little bit longer. So best guess, if we do go down to all the way to 6 months, that's not going to happen well into 2022.
Is there any last words you'd like to give to anyone around the vaccine or anything related to COVID-19 before we head off for the day?
Well, for those of you who watched Saturday Night Live over the last 2 decades, you remember Debbie Downer. I've been accused of being Debbie Downer about the pandemic a lot, and that's often led to being right. But one thing I'm really excited about is the ability to vaccinate teenagers. I think this is, to me, one of the best bits of news we've had since, the first vaccine results last November. I think it's great news for kids. It's great news for parents. It is really part of what it's going to take for us to get ahead of this pandemic. We like to look at things as either all good or all bad. And the news has gone from gloom and doom to the pandemic's over. Well, it's not over. We're moving in the right direction. There's a lot of progress. There are risks out there. And One of the ways to avoid those risks is to vaccinate everybody we possibly can. And adolescents are going to play a huge part in that. So if you got kids, go home and talk to them about it and get them vaccinated.
Dr. Pavia, thank you so much for all the great information. I think this is an important topic for parents who are watching. And if anyone is watching wants to get their child vaccinated or learn more information, they can go to intermountain.com/COVID vaccine. Our scheduling tool is available, and we also have a specific list of where the Pfizer vaccine is being given out for those 12 to 18 years old. Again, thank you so much for joining us, and have a great day.
And thanks to everyone. And one more time, go out and get everyone vaccinated.
Perfect. Thank